Hey, my name is Max Adcock, and today we're going to do a history and physical examination of the lungs and thorax. First thing we're going to start with is talking about history. We will ask about a cough. Have you had a cough recently?
Yes.
You have?
I have.
Is it productive? Not productive.
No.
Okay. Have you taken anything for it?
No.
Okay. Has it been going on for a long time?
No.
Okay, well, good. If it was productive, we would ask about the type of production. If it had any color to it, if it was white or green, if there's a lot of it, a little bit of it, and we would inspect deeper from that. Have you had any shortness of breath lately?
The last 2 months.
Okay.
I'm pregnant.
Yeah, probably caused by the pregnancy. If there was not pregnant, we may go a little deeper into that. We've got a clear cause of the shortness of breath at this point. Would ask about any kind of chest pain with breathing. Have you had any chest pain?
No.
No chest pain while walking upstairs or anything like that? Okay,
Short of breath.
gotcha, okay. Any yeses to any of these? We would have to look into a little deeper, maybe do some more referrals. But in this case, we have a good reason as to why some of these are yes. We'd ask about a history of any kind of respiratory infections.
No.
No respiratory infections recently?
No.
Okay. If there have been some, we would ask about the frequency of those, if they've used medications, if they followed up with any kind of pulmonologist or any other physician for those. Then we'd move to smoking. Are you a smoker?
No.
Okay, that's a good thing. If it's a pregnant patient who's smoking, we would definitely, or any patient who's smoking, we would definitely issue some type of materials to stop smoking. Make any referrals as necessary at that point, maybe look into some medications, but definitely advise them to stop smoking. Next, we'll move to any kind of environmental exposure. Are you exposed to anything that would affect your respiratory status at work?
Yes.
What do you do?
I'm a nurse.
Where are you a nurse?
I practice.
Oh, okay. Well, just make sure you use the appropriate precautions when you're dealing with any type of patients with respiratory issues. And also at home, are you exposed to any type of respiratory things that would cause any problems at home? Well, that's good. If the answer is yes, we may have them look into these issues at home and see if they can alleviate or resolve any of those issues. Next, we're going to look at the patient's skin color. Make sure it's not too pale. Make sure it looks appropriate. Make sure there's enough oxygenation to all the tissues. Next, we'll check the patient's level of consciousness. Do you know where you are?
Yes.
Okay, where are you?
At my house.
Okay. What's your name?
Kelly Adcock.
Okay, do you know what today's date is?
No, I really don't.
Okay.
It's Sunday, July
Sunday, July 16th.
16th. I got it.
Okay, do you know who the president is?
Yes.
Okay.
President Trump.
Okay, good. So I guess that's appropriate. So next thing we're going to do is move into the physical examination. We're going to start with inspection. You can always inspect, palpate, and percuss the anterior chest. We're going to do side to side and then move to the back. If you'd like to, you can do the front and move to the back and then go from side to side in that aspect. It's kind of up to you what you want to do. You just want to make sure it's the same from each side and it's symmetrical what you're doing, just to make sure you're comparing both sides equally. So first thing we're going to do is inspect the anterior chest for breathing, the rate of breathing, the effort of the breath. Make sure you're not breathing too hard. Make sure it's not too shallow, rapid. Make sure it's even. Make sure the patient doesn't look like they're in any kind of respiratory distress. You're not in respiratory distress, are you? Okay. Rest feel good? No chest pain at this point in time? Okay, good. So next we're going to palpate the anterior chest for any subcutaneous air trapping and also for tactile fremitus. Now to do this, we're going to use the palmar aspect of our hand. We're going to place it starting on the right scapular area, or excuse me, the right subclavian area. And we're going to have the patient say 99.
99.
And we'll move to the other side.
99.
And we'll do it again right down here.
99. 99.
Okay. Now what we're looking for is vibration. With the patient saying 99, you should feel that vibration. If it's really dull, that either means you're on the wrong part of the body, or there's a lot of fluid in the lungs that shouldn't be there. So we're looking for vibration. That's really what we want to feel in here. It should be symmetrical from side to side. That's why we went right to left, and then the same thing on the lower side. The next thing we're going to do is auscultate the lungs. So that's listen with the diaphragm portion of our stethoscope. Now we're going to listen to everything on the front side first by moving from side to side, and then we'll do the back side, the posterior side when we go to the back and do everything else on the back side. So these may take a little longer than normal breaths because the patient is pregnant. So we're going to ask her to take some deep breaths whenever she feels the diaphragm hit her chest. Deep breath. Again. 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 Any type of pain with those deep breaths?
No.
Okay. And what you're looking for is just clear lung sounds. You want to hear it equally from side to side. Make sure you don't hear any kind of fluid or any kind of crackles or wheezes in there. So that's it with the front. Now we're going to move to the back. We'll either have the patient turn around from where they are, or we'll just move around the patient like we're doing today. So first thing we're going to do is just inspect. We're going to look at the back, inspect the rise and fall of the lungs as the patient takes a deep breath. We want to make sure it's symmetrical from side to side. We're going to look at the rate of breathing, the work of breathing from the backside, make sure it's not too shallow, make sure there's no pain. We're going to percuss the lung fields like we did on the front, and we'll be sure we stay away from the scapula because detaching the scapula will have that dull sound that we don't want to hear like we talked about on the front side. So with the back side, we're going to use the non-dominant hand. We're going to place it along the upper left lung fields, and we're going to tap with our dominant hand because we want to hear resonance. We'll tap a couple times in a few different spots to ensure we continue to hear resonance all the way up and down. We're going to try and map out the borders of the lungs on the sides and at the bottom. So like I said, on both sides, from the top and bottom, we want to hear resonance, not a dull sound. If we do hear a dull sound, like we said on the front, it could mean that there's some type of fluid trapped in the lungs that we need to look into further. Next thing we'll do is palpate the structures of the posterior back. We're going to palpate for any kind of pain or tenderness. You have any kind of pain or tenderness as it feel through?
No.
Okay, that's good. Now we'll check for tactile firmness in the back the same way as the front side. So we'll have the patient say 99 again.
99.
And on this side.
99.
And then we'll move further down and do it again.
99. 99.
All right, so the same way as the front, we should feel that vibration for the 99 and not feel the dull sound. So next we're going to look for lung expansion and feel for it. We're going to look for diaphragmatic excursion, So we're going to place both our hands around the 10th rib, put our thumbs on the inside, and we're going to ask the patient to take a deep breath. So take a deep breath. Okay, and we're going to look at our hands and we're going to make sure our hands are moving equally on both sides. That'll help us know that the lungs are expanding appropriately on both sides. They have enough room to move. So next thing we're going to do is auscultate the posterior side of the lungs. Make sure we avoid the scapula because we're not going to really hear anything over that. It's going to have a dull sound. We'll do the same thing with the back side by asking the patient to take deep breaths in as we move from side to side. Deep breath. Another deep breath. Another deep breath. Another deep breath. Right, we'll be sure we get the right middle lobe by going underneath the right arm. Deep breath. Alright. Now, just like the front, we're going to make sure that we hear even lung sounds. We don't hear any type of fluid in there. Don't hear any kind of crackles or wheezes. Sometimes wheezes can mean asthma or bronchitis, something along those lines. They may have to refer to a different physician for further studies. So that's it for today. I hope you've learned something about the assessment of the lungs and thorax.